What your eyes are secretly telling you about your kidneys. Let me open with a story that still stays with me. A 25-year-old walked into the emergency room with swollen, puffy eyes. The attending physician glanced at him, assumed it was minor fluid retention, handed him a diuretic, and sent him home. No urinalysis, no kidney function panel, just a water pill and a wave goodbye. 5 minutes after leaving, that young man turned around and came back. His kidneys were failing. Not mildly struggling, failing. He had advanced progressive kidney disease and had been silently, unknowingly leaking protein through his urine for who knows how long. His kidneys had become so damaged that they could no longer hold on to the proteins his blood desperately needed. Think of it like a filter that's been punctured so many times it resembles Swiss cheese. Instead of catching what matters, it just lets everything fall through. When protein escapes through the urine instead of being recycled back into circulation, the concentration of protein in your bloodstream drops, and when blood protein levels fall, fluid stops staying where it belongs. It seeps out of the blood vessels and pools into surrounding tissues. The first place you notice it? Right there, around your eyes. That soft, pillowy puffiness that seems harmless at a glance is your body quietly waving a red flag that most people, and unfortunately some doctors, overlook entirely. After 30 years in clinical practice, I've seen this pattern so many times that I can walk into a room, spot someone from 25 feet away, and immediately think kidney trouble. The puffy eyes give it away almost every single time. I've trained myself not to walk up to strangers and announce it, though the urge is real. But I want you to know what I know, so you can catch this early, because catching it early is everything. The silent thief. How kidney disease hides in plain sight. Here's the terrifying part of kidney disease that most people never hear about until it's too late. You can lose up to 90% of your kidney function and feel absolutely nothing. No fatigue, no pain, no nausea, no warning alarms going off in your body. You could be walking around with nearly devastated kidneys, waking up every morning feeling perfectly fine, going about your day completely unaware that your filtration system is on the verge of collapse. Right now, approximately 35 million Americans are living with chronic kidney disease. Of that staggering number, the vast majority, somewhere between 80 and 90%, have no idea. They haven't been diagnosed, nobody's told them, because their kidneys, remarkable organs that they are compensating, adapting, working overtime to cover for what's been lost, masking the damage until the situation becomes critical. The kidneys are extraordinarily resilient, but that resilience is also their deception. This is exactly why I want to walk you through the visual signs that your eyes can reveal, because by the time you feel something, you may have already lost precious time. The eyes, as they say, are windows, not just to the soul, but to what's happening deep inside your body. Two tests you absolutely need to know about. Before we go further into the eye signs, I want to arm you with two specific lab tests that can catch kidney problems long before symptoms appear. These are not exotic, expensive procedures. They're straightforward, relatively affordable, typically under $30 each, and they could genuinely save your life. The first is the EGFR, estimated glomerular filtration rate. This test measures how effectively your kidneys are filtering waste from your blood. The glomeruli are the tiny filtration units inside your kidneys, and when they become damaged, two things start going wrong simultaneously. Beneficial substances that should be recycled begin slipping through and getting lost, while harmful waste products that should be filtered out start accumulating and backing up into your tissues. The EGFR gives you a clear numerical picture of how well, or how poorly, that filtration process is functioning. The second test is the urine albumin to creatinine ratio, or UACR. This one specifically checks whether albumin, a key blood protein, is leaking into your urine. Healthy kidneys hold albumin in. Damaged kidneys let it escape. This test can detect kidney damage at early stages, often long before the EGFR starts declining significantly. If you have any reason to suspect kidney trouble, or even if you just want to be proactive about your health, Ask your doctor to run both of these. Together, they paint a detailed and early picture of where your kidney health stands. And while you're at it, get your blood pressure checked. Hypertension is one of the most quietly destructive forces your kidneys can face. The kidneys are a network of millions of microscopic filtration vessels, delicate, intricate, precisely calibrated. Sustained high blood pressure is like running a fire hose through a system built for a garden hose. The pressure alone can shred those tiny filtration units over time, even when blood sugar is normal and diet seems reasonable. High blood pressure isn't always the root cause of kidney disease, but it's an accelerant, and it can drive remarkable damage on its own. The goal is to catch kidney dysfunction before it reaches stage 4. And to do that, you have to look at the clues your body is giving you right now, starting with your eyes. Sign number 1, puffy eyes, periorbital edema. We've already covered the mechanism, but let's make sure it's crystal clear. When your kidneys are damaged, protein leaks into the urine. Protein lost from the blood causes fluid to migrate out of blood vessels and into surrounding tissues. The skin around your eyes is among the thinnest and most loosely attached tissue in your entire body, which is why fluid accumulates there first and most visibly. Puffy eyes in the morning that persist throughout the day, particularly when they're not explained by allergies, sleep deprivation, or crying, deserve serious attention. This is especially true if you also notice foamy urine. If you look into the toilet bowl and see bubbles that linger rather than quickly dissipating, that foam is protein. It's the same principle as egg whites. Protein creates foam when agitated. Foamy urine is a direct visual signal that your kidneys are leaking protein, and it should never be dismissed. Pitting edema in the ankles and feet. Press your thumb into your inner ankle and hold it for a few seconds. If the indentation remains after you remove your finger, if the skin doesn't spring back immediately, that's called pitting edema. It means fluid is pooling in your lower extremities due to insufficient protein in the blood. Classic kidney territory. I'll share something personal here. I had puffy eyes myself in my 30s. There's photographic evidence. At the time, I didn't fully connect what it meant. Today, at 61, my eyes are clear, my health is stronger than it was back then, and I understand precisely why those changes happened. The dietary and lifestyle shifts I made transformed everything, and I'll get to those shortly. Sign number 2, pale inner eyelids. Here's a self-check you can do right now in under 10 seconds. Stand in front of a mirror, gently pull your lower eyelid downward, and look at the inner surface. That mucous membrane, the palpebral conjunctiva, should be a healthy, vivid pink. If what you see instead is pale, whitish, or grayish, that's a strong indicator of anemia. And anemia and kidney disease are deeply mechanically connected. Here's why. Your kidneys don't just filter blood. They also produce a hormone called erythropoietin, EPO, which signals your bone marrow to manufacture red blood cells. When the kidneys are damaged and EPO production falls, red blood cell production drops with it. Fewer red blood cells means less oxygen being delivered throughout your body. The result is anemia, and one of its most visible signs is that pallor inside your eyelid. This connection is not subtle. Among people on kidney dialysis, roughly 60% have serious anemia. These two conditions shadow each other constantly. But here's the flip side. If you pull down your eyelid and see bright red, inflamed tissue rather than pale tissue, that's also a concern, and it points in a different direction. Irritated red conjunctiva often correlates with elevated blood sugar, and that brings us to an uncomfortable truth. The number one cause of kidney disease in the modern world is high blood glucose, specifically diabetes and insulin resistance. Chronically elevated blood sugar is uniquely destructive to the kidneys. Think about it mechanically. Your kidneys filter everything in your blood, all day, every day. When that blood carries high concentrations of sugar, it's essentially running an abrasive solution through a precision filter, hour after hour, year after year. That constant abrasion damages the delicate membranes, the tiny vessels, the intricate architecture of the glomeruli. The damage accumulates slowly and invisibly until it can no longer be compensated. Blood sugar management isn't just a matter of avoiding diabetes. It's a matter of preserving the organs that keep you alive. Sign number 3, yellow patches on the eyelids, xanthelasma. Take a look at the skin of the upper eyelids, not the inner surface, but the outer skin. If you see small, yellowish, slightly raised bumps or patches, those are called xanthelasma, and they are cholesterol deposits. Now, you might wonder what cholesterol has to do with the kidneys. The connection is direct and often overlooked. When the kidneys are losing protein, that leaking we keep coming back to, the liver detects the drop in blood protein levels and attempts to compensate by ramping up production. As part of that compensatory process, the liver also significantly increases cholesterol synthesis. The result is that kidney disease can drive dramatic, rapid elevations in blood cholesterol, particularly LDL. Simultaneously, compromised kidney function disrupts vitamin D metabolism. The kidneys play a critical role in converting vitamin D into its biologically active form. When that process breaks down, vitamin D levels fall, and low vitamin D has its own downstream effects on kidney health, creating a compounding cycle of damage. Xanthelasma deposits on the eyelids won't appear overnight. They develop over time. But if you spot them, don't simply attribute them to diet or genetics without considering whether underlying kidney dysfunction might be driving the cholesterol elevation. Sign number 4, white or grayish band along the cornea, arcus senilis or corneal calcification. Look at the colored part of the eye, the iris, and notice the clear dome of tissue that covers it, the cornea. In individuals with advanced kidney disease and disrupted mineral metabolism, a whitish or grayish arc or ring can appear along the outer edge of the cornea. This is calcium deposition, mineral being deposited in tissue where it doesn't belong. Here's the mechanism. When vitamin D regulation becomes severely disrupted, which happens with progressive kidney disease, the body's calcium and phosphorus balance goes haywire. Calcium begins accumulating in soft tissues and structures throughout the body, including the eye. This is called ectopic calcification, and the cornea is one of the places it becomes visible. This sign tends to appear in more advanced stages of kidney dysfunction, but it's a powerful visual indicator when present, and one that many people have never been told to look for. The myth your body is trying to debunk. There's a widespread belief, almost a cultural assumption, that your body will warn you when something is seriously wrong, that you'll feel sick before you get sick, that disease announces itself. Kidney disease dismantles that myth completely. Everything you consume, every sip of water, every meal, every medication, every drink, gets processed through your kidneys. When you drink alcohol, your kidneys bear the chemical burden of filtering it. When you eat ultra-processed, high-sugar, additive-laden food, your kidneys absorb that toxicity. When you take ibuprofen and other NSAIDs regularly, you are directly damaging the filtration vessels in your kidneys. This is not a theoretical risk. It is a well-documented, clinically observed reality. NSAIDs reduce blood flow to the kidneys and can cause both acute kidney injury and long-term chronic damage. The kidneys endure all of this silently. They compensate, they adapt, they protect you from feeling the consequences of your choices until they can no longer do so. And when they stop compensating, they often do it suddenly and without the years of warning you assumed you would receive. What you can actually do, starting now. Let's get practical, because knowledge without action is just anxiety. 1. Reduce carbohydrates significantly. This is not optional for kidney health. High carbohydrate intake, especially refined carbs, sugars, and processed foods, chronically elevates blood glucose. And as we've established, elevated blood glucose is corrosive to kidney tissue. Transitioning to a low-carb nutritional approach doesn't just help manage blood sugar, it directly reduces the metabolic burden on your kidneys. This is one of the most powerful, evidence-supported interventions available to you. 2. Embrace intermittent fasting. Beyond its well-known metabolic benefits, intermittent fasting has specific advantages for kidney health. It reduces the frequency of glucose spikes, lowers systemic inflammation, allows the kidneys extended periods of reduced filtration demand, And, relevant to a symptom we discussed, it can dramatically reduce frequent nighttime urination, nocturia. If you're getting up 2 or more times per night to urinate, that's a significant warning sign that your kidneys are struggling to concentrate urine properly. Intermittent fasting addresses this at a foundational level. 3. Address blood pressure proactively with nutrients, not just medication. For many people, blood pressure elevation is driven by specific nutrient deficiencies rather than irreversible pathology. The three nutrients I consistently recommend investigating are magnesium, vitamin D, and potassium, all of which play direct roles in blood vessel regulation, kidney function, and fluid balance. Correcting deficiencies in these can meaningfully reduce blood pressure in a significant portion of people. Important caveat: if you already have advanced kidney disease, stage 3B, 4, or 5, you must work closely with your nephrologist before adjusting your intake of minerals like potassium. In advanced disease, the kidneys can no longer excrete excess potassium properly, and supplementation without supervision can be dangerous. This is not the time for self-experimentation. 4. Stop taking ibuprofen regularly. If you rely on ibuprofen or other NSAIDs for chronic pain management, have an honest conversation with your doctor about alternatives. The kidney damage from regular NSAID use is real, progressive, and largely silent. 5. Get the labs done: EGFR and UACR. Ask for them by name. Don't wait until a symptom forces you into the emergency room. These tests exist precisely to catch what you cannot feel. One final non-eye sign worth noting. Beyond the visual signs in the eyes, there are two other symptoms worth flagging that shouldn't be ignored. Foamy urine. As discussed, this is protein in the urine, not the casual foam that disappears in seconds. Persistent, frothy, bubble-filled urine that lingers. If you're seeing this regularly, treat it as urgent. Frequent nighttime urination, getting up 2 or more times per night, isn't just a nuisance. It signals that your kidneys are losing their ability to concentrate urine during sleep, which is a function that requires healthy kidney architecture. Nocturia is underappreciated as a kidney warning sign and deserves more attention than it typically receives. The bigger picture. Your kidneys are extraordinary. They filter roughly 200 liters of blood every single day. They regulate blood pressure, maintain fluid balance, produce hormones, activate vitamin D, and manage the acid-base chemistry that every cell in your body depends on. They do all of this without ever asking for acknowledgement. The least we can do is pay attention to what they're trying to tell us. Puffy eyes, pale inner eyelids, yellow cholesterol deposits on the eyelids, white bands across the cornea, foamy urine, frequent nighttime urination. These aren't random or unrelated symptoms. They're a language your body is speaking. And now you know how to listen. Don't wait until stage 4. Don't wait until you feel sick. And above all, don't assume that feeling fine means everything is fine. Get the tests. Adjust the diet. Respect these organs that work tirelessly, invisibly, and entirely on your behalf.